Well, good afternoon, and thank you for this rare opportunity for a Finance Minister to be speaking to people in the health sector. Usually Ministers of Health and Disability make very sure that all the effort they go to cultivate goodwill isn't destroyed by the money man turning up. But I guess it's a sign of how things are changing, and certainly how I'm trying to change the role that I have, that we can have this discussion, because I found myself recently talking to groups from education, quite a lot of different NGO groups in various cities and towns that I visit, and some of them even knocking on my door. I had in my office the other day one of your speakers, Laura Black, from the Dunedin City Mission, explaining a fantastic little piece of feedback technology, which is exactly the kind of thing that we need to see. So I just want to talk briefly about the social investment framework. It's a term that you'll hear more of if you haven't heard of it. Been a bit less involvement and participation from health over recent years, just partly because of its devolved structure through DHBs, and partly because a number of the issues that other sectors are grappling with have been talked about and grappled with for a long time in health, in some respects further ahead and in some respects further behind. So I'm here to give you a sort of unashamedly Finance Minister's view of all this stuff, because you can get the Minister of Health's view anytime. I have to listen to it all the time too. And look, I just want to reassure you, he is a relentless advocate to the point of irritation on behalf, as was the previous Minister of Disabilities, Dame Tariana, who I visited the other day in her splendid retirement. And she is less grumpy. But she was a relentless advocate for the disability sector. So from my point of view, I spent a whole lot of time on the numbers. Is the government in surplus? What's happening with spending? And of course, the actual numbers are not what we're chasing. What we're trying to do is to dig into what drives them. Why is it the Minister of Health turns up every year saying he needs $400 to $500 million, he or she, because it's been pretty much the same for 20 years. Why is it the Minister of Education turns up wanting another $300 million for education every year without fail, regular as clockwork? And when we do dig down, the answer in some respects is so obvious that we haven't really focused on it sufficiently before, and that is these numbers are driven by what people do, how they live, how their community works, how their family works. And I've started using a word which irritates people, and that's why I use it, the word customer. Because a public service doesn't really like the idea of customers. Somehow it's tainted, got a commercial taint to it. But in fact, it denotes someone who's got some choices. Someone who we have to treat well, respect and understand. Someone with whom we have some kind of equivalent rather than patronising relationship. And so that's a starting point. When I sit in my office and people keep coming and asking for more money, I'm now saying to them, well, tell me about your customers. What's actually going on out there that means you're here asking for the 15th year in a row for more money to do what you said you would do 15 years ago? Right? If all the claims made by all the politicians and public servants about what the virtue of getting the next 50 million was, if all those claims were true, we would not have a single problem left. Because I've all sat in finance ministers' offices saying, just give us a bit more money and we'll fix it. So now the questions are pretty clear cut. And you have the answers to most of these questions. I have to tell you, the people who come into my office don't. Which people where. So we don't use categories. I don't want to hear about Māori or boys or people with disabilities. That's not real. What's real is actual people in actual places. And in a small country, we can know who those people are. So the Minister of Education can tell me which people where. She can tell me now in which schools how many kids won't make NCA level 2. And go to a school and say there's 23 kids here in year 9, and actually we've got to get them to NCA level 2. And actually, when we boil down to which people where, we find, of course, there's a whole range of needs. And at the moment, we're using the toolkit of social investment to focus on those with the most needs. I mean, we have to continue to service everybody. Every child under 13 has the right to a free GP visit. But actually, a small fraction of them need a hell of a lot more than that. And so we are focusing pretty hard on the hardest cases. So you would have seen in the Herald yesterday a double-page spread on the most at-risk 1% of 5-year-olds in the country. Now, you might have known about that, but actually, sitting in Wellington, it's been a bit of a revelation to actually understand who are our most challenging people who need the most support. And if I can make a generalised comment about our health and education systems in particular, they've, in the last 20 years, been driven by a sort of universalist approach. You know, everyone should have access to the service, before school checks, every child. Well, the problem with that is some people who need a lot more don't get it. And we set up systems for industrial scale production of things when, to meet the needs of the most vulnerable, we need highly individualised, personalised, sustainable support and intervention of a pretty intelligent sort. And a universal delivery system can't do that. And pumping more money into it won't make it able to. It's designed, for instance, in the case of children, to deal with the 60,000 who are born every year. That's fine. Someone's got to do it. But actually, we want to know about the 600 who are the 1% who we know will cost us enormous amounts of money. That's not the main thing. It's the misery that that indicates. And we want to know what we're doing about them. And actually 600, that's less than in most of our secondary schools. We can deal with that worst 1% one by one. And free doctor's visits for under 6s doesn't do it. That's not dealing with them one by one. And we need to deal with them one by one, because when you know what they are going to cost, you can't ignore it. The work around SIFs that's been published recently, you know, shows that we've got quite a lot of $1 million kids. So when you know what that $1 million represents, which is at the end of it a 10-year prison sentence, but a pretty checkered, difficult time getting there, you can't just sit there and say, oh, we'll just keep doing what we're doing, it's fine. And, you know, sometimes I get a bit of that out of the NGO sector. Whole mixture of reactions. Sometimes people saying, yes, but we care a lot. Well, no one's questioning that. What we're finding is government actually has to show that it cares quite a lot more than it has in the past by actually focusing in on the real needs of people who have the least resource in our community to deal with it. So the harder we lock in at this hard end, the less acceptable it is that we keep doing what we're doing. And that's why you are going to see significant change over things like SIFs. And I can just mention a couple of other groups. We have 50,000 people on benefit who have psychosocial or musculoskeletal conditions. and you're servicing them to a significant degree. One official thing we do, apart from putting money in their bank account, is send them off to the doctor to get a piece of paper that says you're hopeless. And that's the traditional lazy welfare system. We don't do anything systematic about those people who represent billions of future cost. And this is wearing my money hat. I think the number's 15 billion for that group. We can do a lot more than hope that you find them. Because even if you find half of them and do a great job, that's fine. That only leaves 25,000. Living difficult lives on the lowest income you can have in this community and just stay alive. So in the discussions you're having here, you should take that seriously, because that's where we're headed. We're headed to a model of having a better understanding of the family and individual needs of our customers, clarity about who's got the relationship with that person or family, or in some cases community, a trusted relationship, that is that they trust them, not just that we trust them. We can trust all sorts of people not to spend our money and get through it. But it's whether the family or person trusts them that matters. And then some accountability around actually making a difference. Because I often say to officials, if we're going to fail, let's fail cheaply. Right? If we know we're not going to make any difference, well, let's cut the budget by 50%. Because then we can still pretend we care to the wider community, but we've reduced the cost of failure. Because if it doesn't work for them, we don't want to pay for it, even if it works for you. So we just want to be clear about those priorities. And it's pretty hard to enforce them, I must say. You'd think a government machine was about the people that it's meant to service, but actually the accretion of politics, policy and pressure groups means that we're about 50% about the people we're meant to serve and 50% about keeping everybody happy. And not really knowing what we're doing, because sometimes if we found out that we didn't, if people found out we didn't really know what we were doing with their money, they'd be a bit disturbed, because they're out there today digging ditches, sitting behind supermarket counters, standing in front of classrooms, and at the end of this week, payday next week, they'll give us $200 out of their pay packet. And I know if they kept it, it would make a huge difference to them. And that's how much difference it should make to us. So I think it's fantastic you're having this gathering. It's a great lineup of speakers, and I think we're really going to make a difference. Thank you.
Minister, thank you very much indeed. We do have some time for some questions, and no, there aren't any questions. Great.
Tēnā koe. Minister, Rangi Mahura from Rau Awa Awa Kaumātua Charitable Trust. Firstly, I'd like to commend you on commissioning the report that was presented earlier today. What I do wonder, listening to you talk about the $1 million children and the $1 million whānau that I'm sure that are behind them, is do you think there might be scope to commission a report around the funding models and how they have been determined and how they might be determined in the future to be more effective in achieving the outcomes that we need to serve those $1 million whānau? Kia ora.
Okay, so question about funding models. The main issue about funding models is moving from where we are. It's not that complicated about where we've got to go to. The whānau commissioning agents, for instance, and have developed some reasonably straightforward funding models with a bit of flexibility in it, some reasonably clear accountability. Those kind of models make sense for the functions we're talking about, dealing with complex families. You know, we're not trying to disrupt the whole system. So I don't think we need. We certainly need an organised process within government to get, and it's underway, to get a bit more clarity about the models relevant to the groups I've talked about. in a way that's happened with other groups. You know, aged care has got a very well-established funding model. You can argue the rights or wrongs of it, but you know what it is, and the funding for early childhood, very well-developed model. We just don't have a model for people who most need one. That is, persistent people with persistent vulnerability. So yes, we've got to get into that. But the trick is how to do it without scaring you, because you're all on a funding model. And the good thing about the Productivity Commission is people now understand better the weaknesses of it. So short term, government puts you on life support, right? Just dribble enough cash in just to keep you going. Make sure you never get too big and influential. You can't invest, you can't train people, you can't see, 10 years of sustainable intervention, which is what we need for a lot of our core customers. They need 10, 15 years. And I'd say to the officials, where's the structure that's going to deliver me 10 years support for that family or that community? And the answer is we don't have one. They mistake the longevity of government departments for sustainability. Well, there's no evidence that long-running government departments guarantee sustainable intervention. In fact, what they guarantee is that the department will continue even if you change managers every 8 months forever. So that's where we're headed in that direction, and that's why we're very keen to get what you're getting today, and that's intelligence out of the sector. Because one way or another, there's people around who have ignored the rules and done sensible things. And we need to know what those are. And actually, in some places, we've got it right. And we need to understand where that is and try and develop a bit more standardised model for this particular group of customers.
Thank you. We have a...
Great. Good afternoon. As a businesswoman, and I can understand a lot of the things that you're saying, especially about investment. What we're seeing in the sector at the moment, and my area of expertise is in the children's autism area, is that there is 1% that are given quite good help, individualised help, but there is a real grey area that requires an investment so that they don't go into that 1% area. And now probably everybody in this room knows that grey area that is not getting serviced properly, and that is going to cause you great expense in the future if it is not serviced properly. So we are asking for an investment, and when we're asking for more money, the investment is in an area that is not being serviced properly. Now, if I serviced my business, if I looked after the customers in my business well, 1% of the customers in my business well, I would not have a business. So my question to you is, how do we service the people in maybe the top 30% that really need this help, who are going to get worse if they don't need this help?
Okay, can I just make look, I wouldn't want to venture into the Minister's territory around autism, so I won't. But can I make a general point about the health sector? The health sector has more, and health and disability sector has more data and information than all the other sectors put together, but it uses a tiny fraction of it. What's working in welfare, where it's been running for 3 years, and starting in the justice sector, where there's been sort of a bit of a structure, but it's going to get a lot better over the next 6 months, and is certainly in place in education, is using the information you have to shape up just your proposition. Because your proposition sounds a lot like a whole lot of other people, and we have no easy way of discriminating between them, but the sector has the information that would help us do that. So health run very much on a year-to-year cash funding model, and they need to utilise more the social investment toolkit that says, let's understand which people have the highest long-term costs. Okay, because and some of them are starting to do this. So I was at a PHO the other day or somewhere, and they said, here's our 1% of our population generates 49% of our hospital admissions. Well, fantastic. It's great you figured that out, because now you know who it is, which people where. Now you just got to figure out what to do about it, which they hadn't got round to that bit yet. They're still in reactive mode. So the toolkit that we use, like I said about the SIFS kids, we can now say, with pretty high probability what the attract's going to be at the bottom 1%, then the next 5%, then the next 5%, and that model is applicable to any particular group. So if you can say with your kids with autism, here's the kind of costs that are incurred, and we can argue about whether it's just the government costs or the cost of families, because the cost of families can be very high. Parents can't hold down a job, or they've got a shift house or whatever. Then we can see the trade-off. And I can tell you, wearing my finance hat, we want to spend that money. Right? The answer isn't no. The answer is show us, there'll be a payoff. And for a lot of the needs you're dealing with, that's not difficult to show that there's a payoff. It's just no one's come in and argued it that way.
Thank you. I think we have one more.
Tēnā koe, Minister. It's Prudence Stone from the Smoke Free Coalition. You'll be thrilled to see the tobacco returns for 2014, which show that there has been a more than 20% reduction in consumption of tobacco since 2010, which will be a direct result from annual tax increases on the excise tax of tobacco. So my question to you is, are you considering renewing that tax increase policy for tobacco, and when are you going to seriously start considering the same strategy for alcohol and sugary drinks?
Oh, well, with the tobacco one, it's just running. I mean, it's running through. I think there's still another increase to come. So when that's done, there'll be another argument about it. And with the others, the problem is that the way the arguments around that stuff is put is so generalised that it doesn't really have the same kind of cut through as many of the other competing demands. So with alcohol and sugary drinks, as you know, the problem is that in moderation, none of the stuff isn't harmful. There's some populations are obviously a bit more affected by it. The government's certainly going to move on with an anti-obesity strategy, but I think we need to dig in further to know which people where, and to see what the actual costs are, because even as a decision maker, for a short period till we get kicked out again, which is always how politicians are, no one's actually showed me what the actual trade-offs are. They just sort of appeal to the notion that we don't like people being obese. Well, that's not a good enough argument, and we just they've got to drive in a bit harder to say, look, this is what happens. And it's not everybody. In fact, the evidence shows it's 11% of kids who are obese, not 50%. It's not actually an epidemic, so don't exaggerate. It's 10% of kids, and the probabilities of the morbidity that go with that are not 100%. A lot of people get through, so they've got to bore down and make more convincing arguments than they have, and then they'll get a more positive reaction.
Thank you very much. I'm going to have to stop us there because we're out of time. Minister, one of the things that I think you've just touched on beautifully for us to round off our day. So we started with the day with a real close focus on what does it mean for evaluation, measurement and outcomes, and that's been the focus of the whole day. And so what you've just reminded us back about is about maintaining an incredibly sharp focus on what are we measuring, what are the outcomes we're achieving, and how are we going to evaluate them. And I think the challenge is for that to be happening both for government as well as for the providers. Thank you very much for your time.
Thank you.